Now, some news to bring you from NHS England. These are the figures for coronavirus for England. They say a further 159 people who tested positive for coronavirus have died, bringing the total number of confirmed reported deaths in England to 1,284. They give a breakdown of where those deaths have occurred, and they seem to be, by and large, the larger numbers in the London area, but also in the West Midlands. So those are the new figures for England today. Let's get a little bit more from our political correspondent, Nick Eardley, who we can go over to in our studio in Westminster. So the latest figures there, Nick, and also today Downing Street talking about a new way of publishing the data of people who've died. Tell us about that.
Yeah, that's right, Rita. So the figures that we talk about daily at the moment come from hospital deaths. So across the UK, Scotland, Wales, England and Northern Ireland, people who have been tested and diagnosed with coronavirus who die are part of those figures. What we're going to get weekly now is figures which also include deaths in the community. So people who haven't gone to hospital, who have died in some circumstances. That will mean retrospective testing. So once somebody's died, checking whether they had coronavirus. But the hope is that that will give the NHS and politicians and the government as well more of a complete picture of exactly how many people are dying from this disease.
And Nick, the issue of testing and the availability of testing kits in the NHS continues to be a very controversial one that keeps dogging the government because doctors' leaders are saying that they simply don't have enough.
Yeah, so there has been some confusion over exactly how many tests have been done. We heard the government at the weekend talking about meeting their short-term target of 10,000 tests a day, but then Public Health England saying that actually only 9,000 had been done. The discrepancy there is basically between how many have been done and how many can potentially be done, not quite reach. So the capacity is over 10,000 now. The government says not quite that amount have been done. However, I mean, more broadly, the issue of testing is one that we're hearing a lot about from a number of different quarters, because the more people that are tested in and out of hospital, the more people the government knows whether either can be at work or potentially have to go to hospital or require further medical attention. There's a lot of pressure on the government to try and ramp up that figure. The figure that the government wants to get to over the coming weeks is 25,000 a day. That is less than some European countries, more than some other European countries. But we keep hearing both from people in the NHS, from the World Health Organization, and from some in politics as well, imploring the government to try and get as many tests done as possible. Firstly, for medical reasons, to figure out who has the condition. We know, for example, there are many doctors and nurses who are self-isolating at home because some people in their household perhaps have symptoms. If you could test them, figure out they're negative, send them back to work right away. But there's also some political pressure now to try and bring that more broadly. The former Health Secretary Jeremy Hunt saying today on the BBC that if you could have kind of mass testing of the whole population, if you knew who was negative for coronavirus or potentially who had had it before, that could allow you to lift some of the restrictions. So allow some people to get back to work, allow some parts of the economy to start ramping up again. We're not at that stage yet. As I say, the government is trying to increase its capacity to get to that 25,000 a day figure. As you also heard in the piece there, the message from health experts is the more people you can test, the more you know about this virus, the more you can control exactly what's going on.
OK, Nick, many thanks for that. Our political correspondent, Nick Eardley, there.